Wanted to update people on the quick numbers of the day, together with some announcements around both Code Brown and elective surgery. So we've sadly had 13 deaths associated with COVID-19 in the last 24-hour reporting period, and our deepest sympathies go to the families, loved ones of those who are grieving the loss of those people close to them, and our prayers and best wishes go with that too. We are now well and truly over 50%. We're at 51.4% of 5 to 11-year-olds have had their first dose of vaccines. That's a significant achievement, but of course still more to do. In regards to 18 and above for their third dose, or as we're now going to be referring to up-to-date dose, we now have 48.9% of those people vaccinated. And there are currently, in the next 7 days, over 115,000 appointments in state-run clinics like this one available for people to get their up-to-date third dose booster, or indeed their 5 to 11-year-olds, or indeed now their 16 and 17-year-olds. So there are many opportunities in our state-run clinics right across the state, and indeed even more available opportunities in both our community pharmacies and general practices to get those important vaccines to keep you, your family and our community safe. We know that that third dose, that up-to-date dose, will keep you well. The international evidence and the evidence here shows that there is a decrease of being hospitalised chance of over 90% when you have that third dose. So please come forward, look after yourself, your family, your community, keep our schools open, get our businesses back, get our universities back. It's the easiest, simplest thing to do. But as a part of that, we are here today to highlight the fact that we are training people like Aisha as part of 1,000 extra vaccinators who are now coming on the job, over 130 at the moment, more than 700 being trained as we speak, and over the coming weeks we will land 1,000 extra vaccinators into our local public health units to staff important facilities like this one here at Sandown. And with those numbers already on the job, we're able to free up nurses and other health professionals to return back to our public health services and to get them back onto a steady keel, but still incredibly busy locations. This program is making sure that we get people, many of them with a previous healthcare background, or young people like Aisha, able to be trained up, having been part of other support areas of the program, to take that important step to back up as a surge workforce those many hundreds of thousands, indeed millions of people who are still eligible and need to come forward for that third dose, or indeed up-to-date dose, for people to be protected. We heard the Chief Medical Officer earlier this week talk about the big risk in coming months is as we head into winter and to autumn, and to see a return of the Omicron wave, and indeed with international borders and international tourists returning, the prospect of a nasty flu season on top of that. So we know that there will be significant pressures come late autumn, winter, and the most important thing we can do now to protect ourselves for that is to come forward and get vaccinated, whilst protecting our hospitals and making sure that they can operate still under pretty stressful circumstances. So state and national accreditation standards have been met for these 1,000 vaccinators. They will be under direct supervision of nurses and other health professionals. They won't be in the position of dealing with people under 18, and they'll be, in terms of any tricky questions, they'll be under the guidance of senior medical professionals who will, as we've been throughout the course of this global pandemic and vaccination program, there to take people through any concerns they might have. And as we've seen, vaccinations work. And the fact that ATAGI last night reaffirmed that in very strong terms gives us confidence that we will build this third dose up-to-date program in a way that puts us in a safe position come the foreshadowed upswing in cases that we are on alert for moving into autumn and winter. But having hundreds of extra nurses able to return back into our health system and other health professionals is a good thing, and that is therefore allowing us, based on the advice of the hospital's operation team led by Adam and others, to lift the Code Brown pandemic alert as of this coming Monday, the 14th of February. We indicated at the time when this was put in place in January that it would be in place for 4 to 6 weeks. Next week is the 4th week, and we're confident that while still going to be very, very busy, that we are in a position to safely lift the Code Brown alert, whilst in many respects looking to build on the cooperation and the system-wide protections that we're able to put in place through that Code Brown, pandemic Code Brown alert, and Adam will take us through a bit more of the detail of that. In addition, what that means, as we foreshadowed last week, is it also allows us to continue down the path of the careful, steady relaxation of the deferral of elective surgery. And as we foreshadowed last week, as of Monday, we will be making sure that our partnership with the private hospital system is further eased, and that when it comes to elective surgery in metropolitan Melbourne, that those private sector areas will be able to return to 50% of all surgery arrangements, and in regional areas that will be up to 75% of elective surgery arrangements. This will apply, as it does now, in day surgeries locations, but it will be extended to multi-day locations and facilities, therefore allowing those more complex and serious operations to be brought back in. And in regards to public hospitals in regional Victoria, they will be able to resume all Category 2 elective surgery. And the specialist hospitals, the Peter MacCallum Cancer Hospital and the Eye and Ear Hospital, will also be able to resume all Category 2 surgeries. All other public hospitals in Melbourne will, as they have been throughout the entire pandemic, continue their important Category 1 urgent trauma and critical surgery. As we indicated last week, we'll continue to monitor the arrangements in place daily and in close consultation with the private operators, and we thank them for their support. It has been critical. And could I particularly give a shout out to the private acute nurses. I have seen some reports that suggest that somehow or another acres of wards and theatres are being underutilised in the private sector. Let me assure you, from the reports that I've seen, the private acute nurses have been working so hard in supporting not just the existing private patients in the system, which have ramped back up again, and the other parts of the private system, they have been working overtime in supporting the public systems that have been transferred into the private system for COVID support. In addition to that, they've also been working in areas like private residential aged care. They've been part of the squads that have gone in to assist private resi aged care throughout this pandemic. And they have been very much under the radar champions that have been a bit under-recognised, and I want to give them a huge shout out for their efforts. And indeed all the other healthcare professionals in the private system who, without their assistance, we would not be able to have lifted the Code Brown and the further easing of restrictions that we are making today. We will continue to very closely monitor the situation over coming days, but what we are seeing is a continued reduction or a plateauing of both case numbers, hospitalisations and acute illness. Sadly, we are still seeing deaths continue to rise as the most tragic and most delayed of indicators, and we will continue to monitor all of those measures and seek as soon as we possibly can to lift those further restrictions in our elective surgery, provided it is safe to do so and provided that the principle that we've always operated on, that the most acutely unwell people get the most acutely prioritised support. And that has meant invoking the national partnership with the private operators, and I thank them for it. I might hand over to Adam Horsburgh to give us further update, and then we'll hear from Aisha and all the benefits of what it is to be part of the growing vaccinator workforce here at Monash Health. Adam.
Thank you, Minister, and good morning, everyone. As we've said many times recently, the last 2 years have provided a huge challenge for our healthcare workforce, and over recent weeks, Omicron has asked even more of them. And that's why it's been heartening but not surprising to see everyone band together and work even harder over recent weeks under the pandemic Code Brown. Some of the measures that we've seen put in place or accelerated under the Code Brown include surge workforce models to help boost hospital capacity and the redeployment of hospital staff to different roles to help best meet patient needs. There's also been an increased focus on trying to relieve some pressure on our emergency departments. This has included work to speed up the transfer of patients between Ambulance Victoria and our emergency departments, and some departments have installed tents to both increase capacity and to ensure safe social distancing. Many COVID-19 individuals who test positive have also been provided with care and support outside of the hospital system. This has been through outreach models, virtual triage, and where clinically appropriate, the use of telehealth for specialist appointments. So overall, the Code Brown has provided the immediate short-term relief of pressure that our health system needed. And the community have played their role too, by seeking care for non-urgent needs outside of the hospital system. We've been monitoring the data daily, and particularly the number of COVID admissions and the number of staff who are furloughed or not able to work due to COVID. And as the Minister indicated, those numbers have trended down significantly over the past 2 weeks. So today, the 7-day average for the number of COVID admissions sits at 579, with 553 admissions across Victoria as of this morning. The number of staff furloughed today sits at 1865, which is significantly below the peak that we saw in mid and late January. And for these reasons, we therefore think it is safe and appropriate to stand down the pandemic Code Brown with effect from midday on Monday the 14th of February. In doing that, though, we recognise that our health workforce remain under significant pressure, and this pressure arises from staff shortages and fatigue. And for this reason, hospitals will need to continue some of the measures that we've seen in place over the past weeks and indeed during previous waves of COVID. And we as the department will continue to support health services by operating the Health Service Response Centre to provide that leadership and guidance over the coming weeks. In this context, it is important that we continue to take a staged and gradual approach to the restart of elective surgery. And just to reiterate what the Minister said before, as of Monday next week, private hospitals in metropolitan Melbourne will be able to commence 50% of their normal day surgery activity, with that figure being 75% in regional private hospitals. This is contingent on private hospitals continuing to provide the support that's needed by the public system for the pandemic response. Our large regional hospitals will also be able to restart Category 2 surgery, but noting that this will vary from region to region based on local demand and workforce pressures. The Royal Victorian Eye and Ear Hospital will be able to restart Category 2 surgery, as will the Peter MacCallum Cancer Centre. But our other metro hospitals for next week will continue to remain focused on providing care to COVID patients and undertaking Category 1 urgent elective surgery and emergency surgery. However, as the Minister said, none of us want to see these restrictions in place for a day longer than they need to be. So we'll continue to monitor the situation very closely with a view to further easing restrictions as soon as we believe it is safe and appropriate to do so. Thank you.
Hello, I'm Aisha. I'm one of the...
Don't be offended.
I'm not.
Good, don't be.
Apologies to our live viewers for the interruption.
All good?
Yeah, thank you.
Hi again. I'm Aisha. I'm one of the limited scope vaccinators here at Monash Health. And prior to this role, I was part of the administration team, so I was checking people in at the vaccination clinics. And once they opened up this opportunity for us to be able to actually administer the vaccine, I quickly jumped on board. And I'm very excited because I am also a science student, so I'm in my third year of a Bachelor of Science. And I'm very interested in how healthcare all works, and as someone who is pursuing a career in medicine, this is really proving to be an invaluable experience for my education now and for my future. And it's really awesome, and so I applied for the role, and no matter what the background is of an LSV, you get extensive training on how to properly and safely administer the vaccine, and just make sure the patient is comfortable. And we're always surrounded by a lot of really awesome nurses, and we're always under constant supervision, and we can always ask questions. So I feel very supported in that way. And I think everyone should get vaccinated, and I think this is a really awesome way of playing a small part in a very big solution in protecting the community. And that's it for me. Thank you.
Well, you tell me.
Be
Should I
okay.
just speak loud?
No, you'll be right.
Very good? Okay. So we're happy to take questions.
Just on the program, if you certain that you won't need to reimpose it?
Well, we don't have any plans to reimpose it. We think the foreshadowed time frame when it was put on was 4 to 6 weeks based on projections we had from modellers and people on the ground. And next week is the 4th week. We think it's safe and appropriate to lift the pandemic code brown, and we don't have any plans to bring it back.
Just on elective surgery, I think you started in the Premier promise as soon as possible. When can we see them happen to make sure that people get the care they need?
Well, we want to make sure that these restrictions are not in place for a moment longer than they need to be, and they're only in place so as to apply the principle of the sickest people, that is our COVID patients, get the care and support they need, and that has meant that we've had to partner with the private sector to achieve that. Lifting the restrictions further on particularly multi-day surgery next week is a good achievement for those people on the waiting lists. Making sure that our regional public hospitals can return to Category 2 and making sure that our specialist hospitals like the Eye and Ear and the Peter MacCallum Cancer Centre can crank back up is indicative of the confidence that we've got that we have plateaued, and we'll continue to monitor that day by day, and as soon as we can make further announcements, we will.
So do you have a timeline by when elective surgery
as soon as possible, we will be returning not just back to normal, because in a COVID world, with deferred care issues being what they are, we know that when it is safe to do so, we will need to do more in not just catching up, but bringing down those deferred care numbers.
Is that weeks or months away?
Well, as soon as it's capable of being done, we will do so. But on current projections, we're confident that we'll be back very shortly to make further announcements.
Very shortly, what does that mean?
That means as soon as it's possible, we will be back to deliver the news that we indicated last week, that we thought we'd be in a position this week to make further announcements. We are. We hope to be in a position next week, but that will be dependent on the data. We've seen the numbers plateau. We've seen 1 million kids and their families return to school. That generally takes about 2 weeks to come back through the system. That's now happened, and we're confident that the progress that we've made, the plateauing of numbers and the safe operations of hospitals, both public and private, allows us to take this next step.
Just on the blitz though, how will it work? Will the people in most need and with the most urgent surgery go first, or will it be more shared around so that all categories can get up and running?
So we're in constant conversation with the colleges, the medical professionals in both the public and private sectors as to what a new and different model will look like to bring down those deferred care numbers. But the general principle, you're spot on, is that those most critical patients, those most pressing cases get dealt with first. But of course, if you're that person waiting, everything is important and critical. That's why, as soon as it is safe to do so, we'll be returning to not just existing levels, but we have plans to go substantially further.
So are you expecting that before we head back to Category 2, Category 3, that there'll be increases on the amount of Category 1s that we can get through?
Well, Category 1 has never ceased. Category 1 has continued throughout the entire pandemic, and I want to thank our fantastic surgeons and support staff and nurses right across the system for those critical trauma and other cases. All Category 1 has continued. In regards to Category 2, what we are clearly looking to is to re-establish the existing benchmarks as quickly and as safely as we possibly can, and then to go substantially further. But of course, that needs staff, that needs nurses, surgeons, support staff, all of whom have been working like never before over the last 2 years and are exhausted and are fatigued, and we need to make sure that people like Aisha can give us the ability to backfill and bring people into the system in greater numbers to address those challenges.
With National Cabinet's decision last night, does that mean that the Premier's indication yesterday that there could be different rules for international tourists versus Victorians when it comes to being up to date and having the third dose of the vaccination, does that mean that that indication the Premier gave may not occur?
No, I don't believe so. I think what the National Cabinet decision meant, both adopting the ATAGI decision of being up to date with your vaccines, together with the Commonwealth, who control the borders, for the, as I understood the decision, to have as a minimum arrangement anyone who comes in as a tourist to have 2 approved vaccines. That is the position of the Commonwealth, and we look forward to a consistent application of that right around the country, including here in Victoria.
When will you receive advice from the Chief Officer about these updated ATAGI guidelines?
Well, the ATAGI guidelines only landed late yesterday. We've already been in conversation with health around what that will mean, and I look forward to very soon working through those issues with our public health team. And what does that mean to be up to date? The up to date notion, particularly as we head into winter and the foreshadowed spike that we would likely see, means 3 doses for most of the population. For the immunocompromised who are already largely third dose, there's some suggestion from Otago who are looking at this issue, it might mean a 4th dose. For kids 5 to 11 who have yet to complete their 1st and 2nd dose programs, it might mean something else. For kids 11 to 15, it might mean something else. And for kids under 5, where we know that there is work going on, it might mean something else again. So into our 3rd year of this global pandemic, we need to make sure that all our decisions are evidence-based, reflect the best advice, and at the same time, make sure that we achieve the goal of the highest levels of vaccinations we can, because what we know is vaccinations work. They've allowed us to reopen, to get the community going again, and they protect our healthcare system.
National Cabinet only stipulated there should be a mandate only on aged care workers. No mandates for any other sector, such as the ones in Victoria as mandated. Does that mean Victoria might review its position on mandates and whether it would apply to more people when it comes to the preferred shot?
Well, my reading of the National Cabinet decision set a benchmark and explicitly mentioned that it was up to states and territories to go to what they thought the best circumstances that apply to their local situation is. That's what we've done in Victoria. We've followed the national plan to the letter, and the National Cabinet decision talks about a minimum standard, particularly for aged care workers, and you would expect that given the vulnerability that we've seen that sector exposed to. But we've also made it clear that here, frontline emergency workers, healthcare workers, and a range of other groups, education workers, because of the nature of their work, to give them reassurance and allow us to reopen carefully and provide that protection, that they are also covered by mandates here in the state. And if advice comes along to take steps further, then we'll consider that.
Minister, what about maternal health services, so women having babies, that sort of thing? Are there changes to the rules with the co-brand lifting on Monday? Does that mean partners can come in, it's a little bit more flexible for them?
Well, we've always had pretty flexible arrangements compared to other jurisdictions when it comes to hospital visits, up to 5 arrangements in the public sector. Sometimes private hospitals and others go further. We've seen that in aged care, but I might get Adam to talk about what the specifics of the lifting of the pandemic code brown mean.
What about maternal health nurses, the ones that are out in the community, that we heard a couple of days ago that they wouldn't be doing those?
In terms of maternal child healthcare nurses,
sorry.
So they'll also be caught up in this relative ease. And I want to thank local government and our fantastic maternal child care and health nurses, the most qualified in the country for that line of work. They have been instrumental in supporting mums and families in our public health system, as well as trying at the same time to prioritise their work in the community. But I'm happy to get Adam to extend on that. Anything else for me?
Yeah, if we can just comment, I know you went in National Cabinet, but on definition of out of date. If you're out of date, will that rule you out of the vaccinated economy?
Well, we'll work through those issues. Obviously, we just saw the Otago decision endorsed by National Cabinet yesterday. But what we know is that the vaccinated economy approach was a critical part of getting us to that 93% plus level of double vaccinated, the up-to-date equivalent for 2021. Up-to-date in 2022 means for everyone over 18, 3 doses. We now have that expert medical advice, and we have dates set with immunity starting to wane, and the recommendation from 3 months from your 2nd dose, and certainly to have it before 6 months. So we'll now work out with public health advice what that means, how that relates to the vaccinated economy, how we can make sure that the interests of the soon to return international tourist market and international students works into that. It's complex, but we'll do it, and we'll do it properly, but we will make sure that the benefits of the vaccinated economy to drive up vaccination rates are maintained.
So I know you said you're working through what it all means, but up to date, are you reading, does that mean you're fully vaccinated? Is that how Victoria's going to interpret that mean?
Well, fully vaccinated and up to date. So the ATAGI have replaced fully vaccinated with the phrase now up to date, and up to date will mean different things depending on which age category you're in. For aged care residents, as ATAGI have foreshadowed, it might mean 4. They've already made it clear that for everyone over 18, it means 3. For kids 5 to 11 who still have yet to get their first and second doses, it will mean something else. So it'll be a nuanced approach, but it will be an approach that drives forward the highest levels of vaccinations, of which the vaccinated economy is a key pillar.
What about police?
Yes,
Sorry, the Police Association wants a reprieve of 5 to 7 days at least to be able to have officers book in their vaccination in time. Is there any room for movement there?
Oh, look, VicPol have done an extraordinary job for 2 years and achieved really close to 100% of double dose vaccination up to date for 2021. I stood up on the 10th of January and announced the measures that have been in place. VicPol, as I understand it, are giving all officers the opportunity on paid time to book in those evidence of a vaccination over the next month. Next week alone, there's 115,000 opportunities in our state-run clinics, more than that in our pharmacies and GPs. And I'm confident that given the very high levels of vaccination that we've seen historically in VicPol, that we'll continue to see that. And I'm confident that VicPol will meet the public health framework that's been set.
So the original deadline was tonight, and I believe yesterday in the release it came out that was extended until March 12th. So is there some confusion with communication to VicPol about where the deadlines are?
Not that I'm aware of. VicPol, together with all the other agencies, sit on the state control team. These decisions are made through those forums way back on the 10th of January. And given the extraordinary demands that we've seen on VicPol and our healthcare services, the number of people who have been so busy making up for those workers who have been furloughed, Adam talked about 1,800 furloughed today in our healthcare services. We hit a peak of, I'm pretty sure, over 5,000 in our healthcare services. I know there were very large numbers in VicPol, I don't have them to hand, so it's only right that we extend that for a further month to give VicPol and everyone else covered by that the opportunity to establish a proof of vaccine arrangement in that coming month. It will help drive protection for that workforce, but indeed the wider community.
But just to be clear, Wayne Gabb this morning, you may have heard him on the radio, was concerned that for police and AMBO specifically, that deadline is still tonight to get an appointment. To be crystal clear, you're saying that deadline's definitely extended?
No. It was the 12th, so I thought it was tomorrow. But VicPol are giving, as indeed all our agencies have been giving staff opportunities to book in, and my understanding is that VicPol are allowing 15 minutes in every shift to make sure that officers can make that appointment. I'm confident that the vast number of them already have, and that those who need to take those steps can do so quickly and with the support of Police Command to make their workplace safe and to protect the wider Victorian community.
Is the deadline for police tonight at midnight or midnight March 12th?
Well, let me come back to you on that, but my understanding it was the 12th, but I'll just double check on that.
The 12th of March?
I know, in terms of where we're going to in terms of proof of vaccinations, that's, well, it'll have to, my understanding is it will be tomorrow, but let me double check on that, given that it is a police, it's a public health order, but what VicPol are doing is facilitating the opportunities for their members to, who are not yet vaccinated, to use this, an appropriate part of their shift to log on and get those important bookings locked in.
So what are the provisions for people, say they're an emergency service worker, they've gotten COVID in the last week,
Yes,
and
yes.
they can't get a booster in 4 to 6
Yes.
weeks, that's the next
Of course.
advice they've been given. What's their
Of
option
course.
to not work from March 12th?
No. So ATAGI are very clear on this, that if you have contracted COVID, you have up to 4 months in which to then fall eligible for your next vaccination. The clinical guidelines, that's at the outside, the clinical guidelines talk about when it is safe for you to do so, is based essentially on not showing any more symptoms. So the notion of being up to date gets more nuanced when you recognise that many hundreds of thousands of people right across the country have had COVID, particularly the Omicron variant, in recent weeks, and that their processes of their recovery, and therefore they're being picked up by these mandates, has to be taken into account.
The release from yesterday under update says the 12th of February deadline for workers in key sectors to have received their COVID-19 third dose vaccination will be extended by 4 weeks. There's a bit of writing underneath it, and then it says that includes emergency services. So would that include police?
Yes, it does.
So
Yes.
So their deadline has been moved to March 12th.
To get their vaccination, yes.
Booking or
No, to get the vaccination, but for their proof of vaccination that they've booked in, that is tomorrow.
Right, okay. Can I also ask you on another matter, as representing the government today here in the metro area? There was a fatal last night, unfortunately, involving an e-scooter down at Narre Warren, not far from here. Is the government concerned that the trial that's ongoing at the moment, and I guess the lack of understanding of the rules and whatnot, may be leading to these sorts of incidents?
Oh, look, I am very concerned. I want to take this opportunity to pass on our deepest sympathies to the family of the person who was killed, and indeed, given that the matter is presumably being investigated, I know it's being investigated, got to be a little bit careful, but the general principle of the application of the trial to the 3 local government areas doesn't pick up Narre Warren, but what it does show is that there are increasing concerns around how the trial is going. I think it's the City of Melbourne, Yarra and Port Phillip where the trial is underway. We just take this opportunity to reiterate there are safety rules in place for this trial. Please follow them. These, as we've seen last night, this can be fatal. As we've seen in my own community, people riding on footpaths, it is dangerous for both you and those people, both young and old, that you put at risk. So yes, we are concerned, but we continue to work with our local government partners and others to monitor this situation.
There's been a significant amount of fines that have already come out of these.
There's been
a significant amount of fines have already emerged from these e-scooters in the time that the trial's been on. Obviously, safety is an issue. People are on, footpaths when they shouldn't be. Does there need to be a broader information campaign outside of this, e-scooter trial? Because people are using them,
Yeah. Of course it does. But these are for-profit businesses. There's a very large responsibility on local government and these businesses as the proponents of these schemes to make sure that they are safe. We will work with them to make sure that we achieve the highest level of safety as we possibly can. And if anything, given the number of increases of presentations in the emergency departments, I've got to think about what extra demand this is placing on our hard-working EDs at the moment. Whether it's safety, whether it's demands on our health system, whether it's literally the lives of people, I'd urge everyone to show common sense and just be careful and follow the rules.
Do you have any response to some of your successful motion to refer the red shirts issued back to the big ombudsman?
No, I don't. What the Legislative Council resolves is a matter for Legislative Council, and what the Ombudsman does is completely up to her.
Do you think your government's going to have any issues now if there's one extra crossbencher you're going to have to negotiate with?
Last week we didn't have the numbers in the Legislative Council. This week we don't have the numbers in the Legislative Council. We'll continue to engage in good faith with all members of the Legislative Council on our important legislative agenda. Did you want to hear from Adam on that other issue?
Oh yeah, I'm engaged. Sorry. Yeah, so and
Thank you.
I guess just separating the two issues. So maternal health nurses that are doing those sort of home visits, that sort of newborn stuff, are they going to be able to go back to full-time sort of work? Or?
Yeah, it's important to state. So the co-brand obviously gave us a way of coordinating our response to COVID across the whole system, but many measures pre-existed the co-brand, and as I said earlier, many of the measures will continue even when we step down the co-brand. And so we're doing detailed work at the moment about what this means for the streaming model in general for COVID patients, and also for some of those specialist cohorts such as maternity, mental health and paediatrics. So that's work in progress. Not everything returns to normal when we stand down the co-brand, because we still have 550 COVID admissions across the system. We still have workforce shortages and workforce challenges. So we're working through all of those matters as we speak, and it'll be a gradual process before we're able to step down all of the measures that we have in place to respond to COVID.
And you probably touched on this, apologies if I'm asking you something you've already been asked, but I mean, how are you feeling? This has probably been a fairly challenging few months, but do you feel like we've nailed it, or is it still sort of nervous times going into winter?
I don't think we can ever say we've nailed it, because COVID has proven able to take us by surprise a number of times. So we are cautiously, and I personally am cautiously optimistic. I think the trend in the numbers over the past 2 to 3 weeks is really positive. I think this is a good news story that we're able to restart elective surgery, which is something that we all want to do. So we're heading in the right direction. It is positive, but we're taking care to make sure we remain prepared and able to respond if the numbers rise again. So all of the systems and structures we've put in place, they are there, ready to be deployed if we need to in the future.
Adam, I was going to ask as well, obviously co-brand means that healthcare workers can't have their leave sort of taken off them at late notice. What do you think the removal of this co-brand means for healthcare workers, and how are they feeling right now?
Yeah, so when the co-brand was called, I think the healthcare workforce welcomed it greatly. So it really gave recognition to the challenges that they were facing on a day-to-day basis. So I do recognise that stepping down the co-brand will have an impact on the healthcare workforce, but I think our workforce also recognise that even though we're under pressure, that pressure is not at the level it was 4 weeks ago, and indeed didn't progress to some of the higher levels that were predicted at that time. So I think overall the workforce will recognise that this is the appropriate and safe time to step down the co-brand. And it's important again to stress that the co-brand didn't necessitate that staff leave would be held back. So that was just a measure that could be taken place at a local level in exceptional circumstances. And I think it's only been used very rarely across the system over the past few weeks.
Thanks, guys.
Thank you.